I'm Mikaela White in the CBSN Denver studio. As more Coloradans get vaccinated, people are looking forward to traveling again. But is it safe to do right now? Medical editor Dr. Dave Hnida joins us now for our weekly segment. And Dr. Dave, the CDC has issued new travel advice for more than 120 countries. Even if you're fully vaccinated, what is your advice about traveling internationally right now?
Well, I think at this point, once again, the emphasis is on the fact that this is for fully vaccinated people. And I think, number one, you need to do some homework before you leave. So there is some preparation involved in step one. And that means taking a look at where you are going. Specifically, what are the local mandates? What are the local rules, local requirements? What sort of testing is going to be required while you are at your place that you are visiting? You also need to take a look at what sort of proof of vaccination will be required when you are there. Are you going to have testing requirements while you are there? You are also going to just really want to take a look at the local conditions. For example, is there a lot of COVID going on in the area you are visiting? And is there a concern about variants? These are very important things. And then finally, you need to be flexible in terms of your plans, because sure, you may be able to get to your destination. The big question will be, whether or not you can get back from your destination if anything would wind up popping up. After you return, there are a couple things to think about. You would need to obviously be on the lookout, even if you are fully vaccinated. And the recommendation is to wind up getting a COVID-19 test within 3 to 5 days after you do wind up returning from your trip. Now, let's say you are unvaccinated and you are going to travel internationally. Probably not the best of ideas. It's almost like jumping from an airplane without a parachute. It is just not really recommended at this time, especially with all the variants that are out there at this time.
That is great advice there. Okay, so workers at a Texas hospital sued because their employer is requiring them to get the vaccine. Recently, the judge dismissed that lawsuit. So, Dr. Dave, why is it so important for healthcare workers to get vaccinated?
Gosh, these vaccination requirements for workers in healthcare are really, I think, going to be the rule rather than the exception. And in essence, it's going to be no jab, no job. And I know that some of the unvaccinated healthcare workers have arguments that they make in terms of their reasons for not being vaccinated. For example, they claim that the vaccine is experimental. It is not experimental. It has had animal testing done. It has had 3 phases of trials performed, which is done with every new product that is put out on the market. And even though technically it is an emergency use authorization at this time, it is just simply a matter of time before this is a fully approved vaccine. The other argument has to do with, well, my employer can't tell me I have to get a vaccine. That's not actually true because, for example, take a look at flu vaccine. Flu vaccine really has been a mandated situation by most hospitals, gosh, as far back as 2012. And so your employer can require vaccination. And then there is the third point that is personal choice, personal freedom. I think that certainly as a healthcare worker, you do have personal choice and the freedom of making that choice. However, think about sick patients. They do not have the choice whether to be exposed to someone who is unvaccinated and potentially could be carrying an illness into a facility. I mean, think about it. If you had a spouse, loved one in the hospital with cancer or another illness, or a child who is hospitalized, you certainly would want to have everyone caring for your loved one to be vaccinated so that your loved one is protected. So I think it's really important to do this. It's kind of funny. I think when you look at healthcare, and if you are in a job that involves healthcare. It really is an honor and a privilege to take care of people who are in need of healthcare. And I think that if it is simply to go and do everything that needs to be done to protect the people in your care, you're just simply collecting a paycheck, and maybe it's time to look for another profession. There are a lot of ethics involved here.
Thought-provoking. Okay, so Denver has reached President Biden's goal of getting 70% of the population vaccinated by the 4th of July. Now, do you think the state will hit that milestone in time?
Gosh, we're going to be pretty close. We are in a home stretch, and I think we're pretty much, on our last legs as we try to make our way to that goal. At this point, 12 counties in Colorado have already hit that 70% goal, but that means there's a lot of counties that have not and probably will not. There are some counties that are just extremely poor. They're in the 30% range in terms of people even getting one vaccination. And all of these is not an island within the state. People travel back and forth throughout the state. And so, unvaccinated areas certainly have an impact on fully vaccinated areas. And I think that really what we have to look forward to here in Colorado, as well as nationally, there are a lot of places that really are not vaccinating well throughout the country, and there will be interaction with people from those areas, is we may be able to get through the summer okay without a big spike in cases. But I really am concerned, as are many, that there will be some outbreaks come fall as we enter into a different season of the year, as well as different interactions, more time spent indoors, schools going back into session, and so forth.
Dr. Dave, thank you so much for joining us. We're going to talk to you again next Monday at 11 a.m. to get more COVID-19 and vaccine questions answered. We'll be right back.